Dear learners, greeting. Today we are going to talk about another important module in family counseling and family therapy, certificate and diploma program offered by Yellow Pond Academics. In the previous modules, you are having inputs regarding introduction to family counseling, family dynamics, and communications in family, active listening and its importance in the family relationship and family well-being. And today I'm going to come up with another very interesting topic, that need for all the counselors or therapists who are practicing for the welfare of the different kind of families. Okay. Um, as you are aware about it, assessment is about qualitative one. We cannot say objectively, but there are advancement in the field of psychology. It is an advancement in psychometry. Now we can able to give on more precision in the assessment itself, what we can call as in psychometry. Psychometry can used in different setting, for example, clinical setting, education setting, even in marriage and family therapy also, it is very widely used. I'm going to let you know the common assessments used in family counseling or family therapy. It doesn't mean that it is limited only to these assessments, but these are the very commonly used assessment. In addition to that, there are many more assessments can be used based on the requirement. Based on that, the client inputs, we can go for it. Okay. So when you look at these presentation of mine, in this model, I'm going to let you know the concepts regarding the assessment, what is family counseling, and how the need for assessment in family counseling, what are the challenges that could be faced in family counseling. Okay. So when you look at that, the term assessment, what is the meaning of the term assessment? See, we all know that assessment is a qualitative term where we can able to understand that an individual in qualitatively. It is a process. What we will do in the counseling or the family counseling assessment, we will gather the information about the different family members, their communication pattern, their relationship, the boundaries, roles and responsibilities, and many more things we will collect it from the family members. And after collecting the information, we will analyze the information and we will interpret the information. Based on the interpretation, we will make an evaluation and further we'll go for a counseling. So this is the thing we will do for assessment. So assessment, as we all know, that it is not only used in family counseling and therapy, it is widely used in many other fields. Many fields, these counseling assessments are used. Assessment, especially psychometric assessment done in education setting, industrial setting, organization setting, clinical setting. Here we are going to use it in family counseling setting. Why we need an assessment? There are 4 important points I'm going to let you know. One is about when we are, as a counselor, as a therapist, we are making a decision regarding that to improve the better relationship among the family members. The improved decision making of the counselor and this assessment will help the family members to make that appropriate or right decisions in their family functioning. Because it gives valuable information. The assessment gives valuable information. Some of the member in the family, if they have done some mistakes, it will let them know what they have done wrong. Is there is any biases in the communication? Is there is any abnormalities, any deviations from the socially accepted norms? It could be given to them and they will understand it, they will process it. Next one is we can able to find out when we do this assessment, it will increase the accountability. Accountability of what? The members who taken for the particular actions, the behavior, the emotional expressions of an individual can be accountable. So it will help the family member if they make any behavior, it may be appropriate. It will say that this behavior is appropriate. So they will take the ownership. The assessment will say that who is having the problem, who is not having the problem. So clarity they can able to get. And third one is very important. Importance of using assessment in family counseling is that enhance the relationship. The ultimate aim of family counseling or therapy is to improve the relationship among the family members. These assessment will help them to understand their strengths and weaknesses. And when they know the weaknesses, it will help them to overcome the weaknesses and progress on the family relationship. See, when they know about that these are the weaknesses, instead of responding, if they are reacting immediately for any kind of stimulus, that need to be modified. So it is a weakness of an individual that could be given knowledge to the family members. They can able to improvise over a period of time. And finally, we can able to see improved communication among the family members. So the biggest problem we can able to see in any family is poor communication or inappropriate communication that leads to many relationship problems. So here, whether there is an appropriate communication skill set is possessed by all the members, practically we cannot say all the members are having good communication skill. But some people, they may have that naturally, some people they may not have. It need to be educated how they have to communicate with the member to minimize the problem or conflict in the family. So assessment will give clear benefit to the family counselors as well as the members who are taking up the counseling. And even there are many benefits other than the assessment. We are having challenges of assessments also. What are the challenges we see when we are developing valid and reliable assessment? Is not an easy task. We need an expertise. We need an more understanding about that. It is very difficult to prepare a tool in a very quickly. We need to standardize that instrument. We have to validate from the expert, and it is a time-consuming process. It's very important challenges in front of the family counselor to come up with an effective family counseling. Another one is cultural biases. See, some of the tools they may be developed in a particular culture. If we cannot exactly use those instruments to the different culture. So validation need to be done again. And the assessment is very costly for administer and score. Online assessment, if you have taken up, and you may know that assessment need a professional and administer. We need a professional. That means people who trained how to use the instrument. The training need to be given, not only for assessment, but for preparing the report. So these are the challenges in assessment in family therapy. And I'm going to let you know there are 15 common assessment that could be used by any family counselor for making the counseling process most effective. One is family genogram and echo maps, and we will see one by one in my coming slides. What is genogram? Genogram is a diagram that maps the family relationship across 3 or more generations. When you look at these examples, see the symbol indicates female and this square symbol indicates male. And you can able to see the victim, some of the members are victim. The cross symbol indicates that divorced. And by using these symbols, and we can able to understand the family structure. We can understand the relationship among the family members. The very important tool, every counselor who are working for the family welfare must have these genogram templates. Genogram can be used to identify for what? The pattern of behavior among the particular family members. When we know the behavior, appropriate, inappropriate behavior, it is very easy for us to help the people to overcome the problem. Second one is we can understand the mental health, whether mental health condition of the family members are good or not. If not so, what are the remedies we need to take up? And family dynamic, we can understand the dynamics of the family when the problems are arises. What kind of situation the family members are more frequently having the problem. So these will give clear understanding. When we know the clear understanding, and we can able to solve the problem of the family members. There is a quarrel in Tamil, Noi Nadi, Noi Mudal Nadi, Adudanikum, Vai Nadi, Vaikpacha, which means when you want to solve the problem, you have to understand the root cause of the problem. Not only the intensity of the problem. That could be done by using genogram assessment. When we do that root cause, then we can able to tackle the problem very easily. Genogram is one such a tool, one such assessment in family counseling, and effective family therapist will use to help the people to improve the relationship in the family system. And second one is echo maps. So when you look at these picture, Harry and the relationship with other grandparents, parents, and the friends in the school setting and the play area, and you can able to see who are all having strong relationship, who are all not having the strong relationship. These detail we can able to get it. The previous one it is about holistic, overall view about that the family system. But here is a more specific to the particular person where we can able to understand intense information we can able to get that gives in-depth understanding about the client. So we can able to make a right decisions based on their family, the home, school, and the community. So it will help us, the family counselor, to identify that where the problem are surfaces, the sources of the problem, and whether the family is supportive or non-supportive, whether the family can help them to overcome the problem or not. So these information we can able to get echo maps assessment. And third one is family interaction scale. So there are many versions are there. I'm going to give one of the, whether the interactions, as I said, communication is very important tool that need to be analyzed, assessed by the family counselor to know whether the family is a dynamic or not, effective or not, healthy or not. So these family interaction scale will help us to know about that, whether there is an cohesion or a adjustment is there among the family members. So whether there is an emotional bond is there between one member to another member, whether one member can adapt to the other members' situations, whether they can able to change their behavior, the expectations of the other members. So this scale will give an insight regarding the adjustment level and the emotional bond among the family members, how they are interacting. And fourth important assessment that could be used in family counseling is that the family environment scale. Environment is very important too. Now, you and me may be very good, but the environment is not comfortable, the problem may arise. So these scale will, it is a self-report scale. It has many dimensions like cohesion, whether there is an expressiveness is there in the family or not, whether the conflict is there or not, the roles and responsibilities, organization, the control, achievement, orientation, intellectual orientation, independence, and religious orientation. So these 10 dimensions we can able to make clear understanding about the family environment. And the family environment is good, and we can understand that the problem is the individuals, not the environment. So here, when we have the doubt about that environment plays a crucial role in that family problem, then we can use this instrument, especially for improving that environment. See, it will help us to identify the area that need to be strengthened. It will help us to know about the weakness of the family environment, that when we know the weakness, we can help the client to improve the weakness, to challenge the weakness. So when they are challenging the weakness, they can develop the skill set in the particular area. So another important is on communication assessment. So it will help us to know how family members are communicating with each other, this assessment. Not only that, it will assess that communication style, what kind of communication style an individual and the family members are using. If there is any barriers in the communication, the overall quality of the communication is effective or not, healthy or not, that detail can be understood by using this communication assessment. Next one is parenting style. There are 4 important styles that are authoritative, permissive, authoritarian, laissez-faire. And these family style, when we are aware about it, we can able to encourage an appropriate family, the parenting style in the family members, so that will improve that family dynamics. And another assessment is on conflict resolution style assessment. So when there is a conflict comes, how the family members are looking to that, how they are making a decision to resolve the conflict. See, when there is a conflict arises in the family, they have to understand that the conflict and which member is a root cause for the conflict, and whether the conflict resolution style of the individual or the family members are effective or not. That detail need to be bring it to the knowledge of the family members in the counseling session. So that will make to understand that, okay, what they are doing is good or not. The next one is about family satisfaction and happiness assessment. Is we are moving towards that well-being of an individual. Then we are moving under the well-being of the family members. So family satisfaction is very important. This assessment mainly focusing on that overall satisfaction among the family members. Not only with that, it will focus on the happiness of the family members as well as the individual and the family members. See, when we do this assessment, we can able to know about that. What are the things that give satisfaction and happiness to the family members? What are the things that not giving happiness or satisfaction to the family members? So that will help us to suggest to the client who are coming for the family counseling what they have to do, what they are not supposed to do. That can be amazing assessment, I can say. And the next one is intimacy and connection. Is one of the very important traits that need to be examined. Whether the people are having emotional closeness or physical closeness or just for pseudo closeness. So connection in the family members need to be explored. And if the quality of relationship and the intimate relationships are good, and then we can encourage them to continue that. If it is less than that, then we can give an intervention strategy to improve that intimacy and communication among the family members. Family goal as setting assessment. See, we have to move a particular goal. See, when there is when as a family counselor, when we are evaluating the quality, of the family, if there is a poor quality in the family members, and we have to suggest and they have to set a goal. So they have to address the problem one by one, not exactly all the problem in a single shot. Practically not possible. So assessment will help them to prioritize the goals and which will make them to move forward and they can able to find the sense and purpose in the life. When they know about the meaning and purpose in the life, they can move without any conflict. And another one is boundary and flexibility assessment, whether all the family members are having that boundary, healthy boundary setting or not. If the children are less than 16 years, there's the role of the parent. They have to take care of the boundaries of the children. They are the one ideal role model to teach them and how they can maintain the boundary. And defined boundaries are very important that need to be taught by the family counselor to the family member. This assessment will help them to know whether the boundaries set by the family members are effective or not. And next one is about love language assessment. It's very important assessment, I can say. In the relationship, the 5 love languages suggested by Gary Chapman is very useful, which will help them to know which area is the primary love language of the partner, and they can able to switch over their behavior, and that will improve the relationship of the couples. Word of affirmation, act of service, receiving gifts, quality time, and physical touch. Among these 5, and he suggested the top 2 are primary love languages and other 2 are secondary love language. It is important duty of the partner. They have to understand that what is the primary love language of the partner, and they have to act accordingly to improve the relationship. And finally, substance use and abuse. Definitely, it is very important. Not only substance use, I given a picture here, even mobile phone use and abuse that also need to be counted. So that will help us to know about the abuse and use of excessive use of these substances or like drugs or mobile phone that will harm the relationship. So we have to understand the pattern, how they are using it. It can help them to how to overcome the addiction level in these substances. And finally, the family support system. If there is a problem happen in the younger members in the family, if there is elders members support system is helping them to overcome the problem or not. If not, then we have to help them to understand that importance of family support system. And especially in extended family and friends and nuclear family, these support system need to be understood. If the support system is poor and that need to be improvised, if the support system are good, and we can encourage them to taking the lead from that support system itself. And the next one is sibling relationship assessment. The dynamics is there in a family when they were progressing. The dynamics will sometimes they will be very close, sometimes they may not be close, and we can understand that why they are very close with that, why they are not close, what is the communication they are using, is there is any conflict, is there that hinder the sibling relationship, and if there is an overall quality of relationship is improved or not, that detail can be studied. And finally, extended family environment assessment. See, there are many components are there. Here we can able to know that extended family and nuclear family are very common problem. Even single parenting children's family are very popular. And when we know about that, the impact of these nuclear family and single mother, single father family, and that need to be understood, and what are the things that need to be taken care of, it need to be educated properly as a family counselor is very important. So that's why, as he said, there are not only these 16 assessments are there are many assessments are there, but I can say as a course mentor of this module, there are many assessments we can use in the family counseling and therapy, but these 16 are very important. Very important. I hope these inputs are useful to you. And all these instruments are having that a template from Redpond Academics. You can contact the coordinator and they will give you template and they will give orientation to you. Take up and you can proceed further. Thank you. I hope you will understand the concept. We'll meet with another wonderful module in the family counseling and therapy certificate and diploma program. Thank you all. Bye-bye. Take care.